What's up, everyone? Dr. Eric Jackson here. Wanted to sit down and talk about one of the more common questions actually I get from patients. Um, it's what's the difference between a dentist who has DDS after their name versus a dentist that has DMD after their name? On the surface, it's actually a pretty quick answer. Nothing. They're both exactly the same. They're both licensed dentists. But I want to take it a little bit further and, like I always do, look into it a little bit further and the philosophical aspects behind it, because I think actually you'll like doing so. I'm a DDS, DDS MAGD written there on the scrub top. That is, it stands for Doctor of Dental Surgery, and I think that's actually let's start there. I actually talk to patients quite a bit about the S in DDS. It stands for surgery. The reason for that is because patients today often just kind of think that dentistry is easy peasy, it's just a filling, and often they're right. It can be done very predictably in the right circumstances, in the right situations, but really, it doesn't always work that way. It is a surgery. Even a basic little filling we are changing part of your body forever. I am actually applying anesthetic. I am doing a medical procedure on you, and then you are going to recover afterwards. It's to a lesser extent, a very similar in process to any other major surgery, whether it's I use the analogy of a nose job quite a bit, or plastic surgery quite a bit. People are aware of plastic surgeries because of all the TV shows about plastic surgeries and this and that. They're very in tune with the fact, well, all right, I know I'm going to get a nose job. There are certain things to do beforehand. You have to evaluate, you have to do some stuff, then you have to do the surgery, and then on the day but then they always focus on the aftermath, the recovery aspect. Take all that, reduce it by a lot, and you can easily compare it to a filling. All that applies, all the philosophical aspects apply, especially the recovery. We'll talk about what the patient has to do to be on the ball and be on top of their recovery, whether it's making sure the bite forces are even, the occlusal forces are nice and even, nothing standing out from the crowd, making sure that it doesn't hit first in vertical motion or in function, in any way, shape, or form. It's got to jive with the rest of the team. Whether they're going to have soreness, is it normal or not? Is it anticipated or not to have X, Y, Z afterwards? You might have some discomfort from the injection point. Maybe the tooth itself is going to have a little bit of discomfort in a variety of different ways. There's millions of things that we can talk about that patients often just kind of think, it's a filling, I'm not even going to worry about it. They'll schedule a filling, and then they might even forget they're going to be numbed, probably. I've had patients that ask, is this going to wear off in the next 15, 20 minutes? I've got a date. That was I use that as an example all the time. I say, well, no, it's not going to do that. We went on, and he still went on the date. It was fine. But these kinds of things often get overlooked because it's just a filling. So think about it. If you're a patient, think about it as this is something a little more significant. It's a surgery. Treat it as such. Talk with your dentist. He or she can talk to you before, obviously talking to you during, and then equally as important, talking to you afterwards, knowing what to expect. I like, obviously, educating people. That's why we have this YouTube channel. It's very important to do so. So really, and it has to come back the other way. They have to call with questions, know what to expect, and if you deviate from the expected norms, make a phone call, send an email or a text, whatever the method, just make sure that everyone's part of the same team. So knowing that it's a surgery and having the DDS is a wonderful type thing. I think it works out really great from an explanatory standpoint for patients. DMD. DMD stands for dental medical doctor, right? It's essentially the next evolution of dental education. A lot of younger dentists are graduating from dental school with DMD after their name instead of DDS, and I think it's fantastic. I've long preached that dentistry and medicine are not separate entities. It is very important that we in the dental profession view ourselves as a subspecialty of medicine. There are countless times per day, I almost guarantee it, in your office that you talk already about medicine, whether it's talking to the diabetic patient about how their uncontrolled diabetes or poorly controlled diabetes affects their teeth and their oral health, about how that person who is always tired and has evidence of oral evidence of sleep apnea, looking at tonsils, looking at soft palate, looking at the way everything comes together, might have issues with sleep apnea, might have been diagnosed in your office even. I'm happy that I'm proud that we have a CBCT in our office, and when we take a scan, much like any x-ray, you'll see things in addition to what you're looking for. So say we take a wisdom tooth scan, both jaws, etc., and you can see the sinuses, maxillary sinus, nasal sinus, a very important thing to know about, but also a very important opportunity to educate patients on. They will receive a cleaning, they'll get a scan for a wisdom tooth or tooth extraction at the oral surgeon, or perhaps your own office. Then you're able to talk about, well, did you also see over here, you see how your septum is deviated to the right? Do you have trouble, breathing out of your nose? Do you feel like you're breathing out of your mouth a lot? Does that correlate perhaps with the fact that you always feel like you don't have enough saliva? Maybe you do have a lot more mouth breathing in the anterior. Maybe the gums are puffier in the anterior. That might be correlated together, and it all is related to the nasal sinus. Maybe the maxillary sinus has a lot of inflammation, polyps, who knows what in there. And that can influence everything from balance to ears to everything else. There are so many fringe areas of dentistry that absolutely and justifiably overlap with medicine, that we as dentists need to make sure that we are open to evolving into dental medical doctors, DMD. Even if we were trained as doctors of dental surgery, the mindset has to be evolving that we're treating the whole person and not just the mouth, not just the oral condition. But with that said, we're still dental professionals. We're not medical doctors. So what I've done, and I think it would be a great idea to consider if you haven't done so, is cultivate a team, some familiarity with local medical doctors, an ENT, perhaps a sleep specialist. Perhaps I've got, for example, for ENT, several individuals in the area that deal exclusively with pediatric obstructive sleep issues. A lot of great care has come from my recommending, identifying a few things, whether it's grinding at night, whether it's pediatric wear and tear to the teeth in certain patterns, knowing that often can jive with airway issues, making the recommendation that mom or dad bring the child over to the pediatric ENT has worked wonders. Likewise, the same for the adults. Go over and see the adult ENT, get a sleep study, do the whole workup, all at the behest of the dental professional. I guarantee the ENT will be very impressed that the conversation's being had by you, by the patient, and just the level of medical care, medical and dental care, but we're going to say medical because the dental is part of medicine, is going to be very much respected by all parties. Medical doctor, patient, and then of course friends and family, because when John Doe gets diagnosed with sleep apnea because they did a great job at the dental office identifying this potential condition to then get it confirmed by the medical doctor and then treated properly, so on and so forth, it just wonderfully snowballs into a much better, healthier individual. And John Doe is very much appreciative, as well as free and often talks to friends and family, which only benefits your office more. The key is making sure that we're treating the entire human condition and not just the dental condition, the oral conditions. So in a sense, that's the gist. DMD is the next evolution of the mindset of dentistry. There's countless examples: diabetes, We already touched on sleep apnea, all sorts, exercise physiology. It depends on whatever your passions are. I do a lot of sports dentistry. We do a little bit of everything, frankly. But find what you like. Find what you like. Pick one thing, and then run with it. And then make that your passion. Add to it as needed. Then all of a sudden, pretty soon, you're treating the entire ball. You're no longer just a dentist. You are a respected medical professional in your community and in your field. And I think it's going to be a really great evolution for the young dentist to get into. So thanks so much for your time. I always love these videos, just sitting down and just kind of sharing. It's what we do here in the office a lot. I just like the idea of getting it on tape, getting it on video tape. You can kind of tell how a little older now, and no one uses tape anymore, Doc. Anyways, so although I still say tape things, I don't know, it's up to you how you phrase it, even DVR. But anyways, like the channel, subscribe to the channel, like the video. Make sure if you subscribe to the channel for the first time, please hit that bell. That'll give you the notification whenever I post a new video. It'll come right to your smartphone or computer or whatnot, whatever device you're looking at the time. And then also, most importantly, comment below. The comments are going to be fantastic as we go through this. Let me know likes, dislikes, future topics you want me to cover. Ideas are always welcome and appreciated by me. I've got a bevy of things swirling around up in here, but ultimately, I'd love to know what you want, because let's just talk about what's common ground between Dr. Jackson and viewers, so to speak. So ultimately, thanks so much, and I will talk to you soon. Have a good one. Bye-bye now.